Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
You know that feeling, the sheer excitement and anticipation when you're waiting for a new baby? It's just profound.
It really is.
But imagine that whole journey gets cut short. Suddenly. Way too soon. That's the reality for millions. We're talking about preterm birth. It affects what, about 12% of pregnancies here in the U.S.?
Yeah, roughly that. And it's a major public health issue. Some places, like South Carolina, actually have particularly high rates.
And it's serious. The leading cause of complications, even death in newborns.
Tragically, yes.
So today, we're going to really dig into some exciting new research stuff that's not just about managing the fallout of preterm birth, but actually aiming to prevent it.
Targeting the root cause. That's the key shift.
Exactly. We've got a health news piece and a scientific paper, both out of the Medical University of South Carolina, to guide us. So let's unpack this. Why is finding a root cause so critical here?
Well, it's fundamental, really. We do have some ways, some medicines to try and, stop preterm labor once it's already started.
Right, reactive measures.
Exactly. Reactive. But therapies that actually prevent it by tackling the underlying trigger. They're really very limited.
Which is why the rates haven't budged much.
Precisely. We're stuck trying to put out the fire after it started instead of, stopping the spark.
Okay, so previous work had pointed towards inflammation, hadn't it?
Yeah.
But the actual source was kind of murky.
That's right. The link between inflammation, often kicked off by an infection in the amniotic fluid, and preterm birth wasn't new.
Okay.
But the big question was, what exactly was driving that inflammation? What was the biological switch getting flipped? That was the mystery they needed to solve.
And that's where this new research comes in, identifying a key driver, the complement system.
Yes, exactly. The complement system. It sounds a bit technical, maybe.
A little.
But basically, think of it as a set of proteins in your blood, a really crucial part of your body's natural immune defenses. First responders, you could say.
Okay, so usually it's helping us. How does something designed for protection end up causing a problem like preterm birth?
Yeah, it's kind of a paradox, isn't it? Normally, it's our ally, fights off bugs.
Right.
But if it gets activated in the wrong way or, too strongly during pregnancy, it calls in the troops' white blood cells, leukocytes.
Which are usually good guys, too.
Usually. But here, too many of them show up, they get overactive, and they create this persistent, damaging inflammation. It's like, like your house alarm going off and calling the fire department, but then the firefighters start knocking down walls unnecessarily.
Okay, I get that analogy. So there's internal damage.
Well, the sustained inflammation, it can actually weaken the cervix. The cervix acts like a gate, right? Holding the pregnancy safely inside.
The gateway of the pregnancy, as they put it.
Exactly. And if that gate is weakened by all this inflammation, it can give way too early, leading to premature delivery.
And it's not just about the timing. You mentioned something about the baby's brain.
Yes, that's a crucial and quite sobering finding. The same inflammatory process driven by the complement system seems to be linked directly to inflammation developing in the fetal brain itself.
Wow. So it's a double hit. Potential harm to the mother's pregnancy and the baby's developing brain.
Precisely. A very serious connection.
So, okay, they had this theory about the complement system being the culprit. How did they test it? What did the actual science look like?
They used a pretty standard approach in this field, an animal model, pregnant mice.
Right.
This lets them simulate the kind of uterine inflammation, often from infection, that can trigger preterm birth in humans. Specifically, they use something called LPS.
LPS.
It's basically a component of bacteria, an endotoxin. Giving it to the mice mimics a serious bacterial infection and triggers that inflammatory response they wanted to study. They did this on day E15 of the mouse pregnancy.
And what did they see happen in those mice?
It was quite striking. They saw complement activation ramp up very quickly, and lots of those white blood cells rushed into the cervix.
How quickly?
Really quickly. They could detect signs as early as 1 hour after the LPS, with a big jump by 9 hours.
So it's an early event in the process.
Very much so. And crucially, these early immune changes were strongly linked to the mice delivering preterm. It was strong evidence that, yes, the complement system was a key early player.
Okay, so complement system identified as the driver. The next logical step is, can we block it?
Exactly. And that's what they tried. They used a specific drug, a complement inhibitor called CR2-CRY.
CR2-CRY, how does that work? And you mentioned it's targeted.
Yeah, targeted is important. It works by interfering with a key enzyme complex in the complement pathway, something called C3 convertase.
Okay.
Think of C3 convertase as like a major amplifier in the system. Blocking it shuts down the production of the main molecules that actually cause the inflammation.
Got it. And the targeted part.
That means the drug is designed to go specifically to the places where a complement is being activated. It zeroes in on the trouble spots.
Ah, so it doesn't just suppress the whole immune system everywhere.
Exactly. That's really important for reducing potential side effects, unwanted off-target effects. You want to keep the rest of the immune system working properly.
Makes sense. Yeah. So they gave this CR2-CRY inhibitor to the inflamed pregnant mice. What happened then? The results must have been, well, what were they?
They were really encouraging. Quite remarkable, actually. First off, inflammation went down significantly.
Where? Just in the uterus?
Both. In the maternal uterus and in the fetal brain, which points to that dual protection we talked about.
That's huge. What about the actual pregnancies? Did they last longer?
Oh, absolutely. The mice that got the placebo, the control group, they delivered pretty quickly after the LPS, around 31 hours later, so just over a day.
Okay.
But the mice treated with the CR2-CRY inhibitor, they carried the pregnancies much, much longer, on average about 109 hours, so over 4 days later.
Wow, that's a big difference.
It is. It translated to a median gestational age of 20 days for the treated mice, compared to just 16 days for the untreated ones. Essentially, it pushed them back towards a full-term delivery.
And the pups themselves, were they healthier? More likely to survive?
Yes, that was another critical finding. The treated mothers had, on average, 2.4 viable live pups.
Compared to?
Compared to 0 viable pups in the untreated group. 0.
Goodness. So the treatment made the difference between life and death for the offspring in this model?
It certainly seems that way in this model, yes. And they also looked at specific inflammatory markers, these signaling molecules called cytokines, like IL-6 and MCP-1.
Those are like the alarm bells of inflammation.
Pretty much, yes, key drivers. And in the treated mice, the levels of these cytokines were way down, both in the uterus and the fetal brain. They were back down to levels similar to what you see in normal, full-term, healthy pups.
So it calmed the whole inflammatory storm.
It really did. As one of the researchers, Dr. Eliza McElwee, summed it up, by targeting complement, we could decrease rates of preterm birth and reduce fetal neural inflammation.
That really captures it. The 2-for-1 benefit seems clear. Protect the pregnancy, protect the baby's brain. So let's broaden this out. What does this mean for us, for human health? What are the bigger implications?
Well, this really lays the scientific foundation for a potentially new way to treat this, an approach that doesn't just focus on the delivery timing, but also on protecting the baby's brain development.
Which is linked to things like fetal inflammatory response syndrome, or FIRS.
Exactly. FIRS is a known issue, and high levels of that cytokine IL-6 are a clinical marker for it. If you can reduce IL-6 and other inflammatory signals,
you might prevent downstream problems.
Potentially, yes. Things like lung injury, kidney problems, gut issues, and importantly, neurological problems later in life.
And the paper mentioned a possible link further down the chain with another cytokine, IL-17A, and autism spectrum behaviors.
Yes, they noted that connection, which just highlights how far-reaching the effects of this early inflammation might be. Reducing it could have long-term benefits.
And I like that quote from Devin Hatchell, another researcher involved.
Ah, yes, about treating the mother.
Right. All the therapy was given to the mother. This suggests that we can take care of the mother as well as take care of the offspring at the same time. It feels so integrated.
It does. It echoes Dr. McElwee's point, too. Healthy pregnancies mean healthy babies. It's all connected.
So is this type of drug a complement inhibitor close to being used in clinics?
Yeah.
Are there similar things already out there?
There's definitely progress on that front. Several drugs that block the complement system are actually already in clinical trials, though mostly for other conditions like certain autoimmune diseases or blood disorders.
Okay.
And importantly, one drug that works similarly to the CR2-CRY used in the mice has passed phase 1 safety trials, showing it's well tolerated, and it's now in phase 2 looking at effectiveness.
But not specifically for preterm birth yet.
No, not yet. It's crucial to remember that. While promising, none are approved specifically for preventing preterm birth or the associated fetal brain inflammation. Getting from promising animal studies to approved human use is a long and careful process.
Absolutely. Which brings us to the next logical question. What are the hurdles? What stands between this research and helping expecting parents? What do the researchers say about limitations or next steps?
Like all good science, they acknowledge what still needs to be done. They point out the need for a deeper dive into the exact immune mechanisms.
Meaning?
Things like detailed immunophenotyping, really characterizing all the different immune cells involved, and spatial mapping, seeing exactly where these cells are active in the tissues, getting a more granular picture.
Okay.
And of course, the big one is translating this to humans. Future studies will need to figure out the right dose, the best timing for treatment, ensure safety during pregnancy, and confirm it's actually effective in people. Lots of work still ahead.
But didn't they also find something interesting about timing? A potential window to intervene?
Yes, that was quite insightful. They noticed that after the LPS trigger, the mother's inflammatory response ramped up first.
Okay.
And then there was a delay before the fetus started producing its own inflammatory cytokines.
So there's a gap, a window of opportunity.
Potentially, yes. It suggests there might be a specific time frame after an infection or inflammatory trigger starts where giving this kind of therapy could be most effective at preventing both the preterm birth and the fetal complications. Timing could be critical.
That makes sense. Getting in there before the cascade fully takes hold in the fetus, too.
Exactly. And Dr. Stephen Tomlinson, his lab was involved, sounded quite optimistic. He said this study certainly paves the way for expanding the investigation of complement inhibitors as potential therapies for infection-induced preterm birth.
It really does feel like paving the way. Imagine a future where that fear, the fear of preterm birth and all the complications that come with it, could be genuinely lessened, maybe even eliminated for many.
It's a powerful prospect.
And this research suggests that really understanding our own biology, these intricate systems like the complement pathway, might hold the key. A targeted approach based on deep understanding.
Absolutely. And that's the real value of this kind of fundamental research, isn't it? It's not just about treating symptoms after the fact. It's about uncovering why things happen.
Understanding the mechanism.
Precisely, because that understanding is what leads to truly transformative approaches to care. It offers real hope.
Well, this has been a fascinating deep dive. Hopefully, it's given everyone listening a clearer picture of both the challenge of preterm birth and the incredible science working towards solutions.
It's definitely an area of active and important research.
We absolutely encourage you to stay curious, maybe even look up the researchers we mentioned, Dr. Eliza McElwee, Dr. Stephen Tomlinson, Devin Hatchell, and follow their work. It's truly impactful stuff.
Agreed.
Thank you so much for joining us today as we explore the science aiming for healthier starts for babies and families everywhere.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.